Welcome to the Hormone Optimizing Warrior MD, your reliable and trusted source for information on hormone therapy for menopause and beyond, and on how to advance into the second half of your life with confidence and optimism, knowing your hormones are optimized and balanced with everything else in your body. Whether it is hormone therapy, peptide therapy, laser therapy, or some other new technology applicable to maintaining our vitality, mental and physical strength, you will hear all about it in this podcast. Today's the last episode on the series of testosterone and cardiovascular health in women, specifically testosterone therapy, how we monitor it, how we make sure it's safe. And I did speak about the testosterone receptor expression, the relationship between testosterone dosing and the duration of testosterone exposure, how these two very specific factors, the dosing and the duration, influence a woman's metabolic markers and influence ultimately her safety during testosterone therapy. So in this episode, I'm going to continue the conversation around this topic. And I left off mentioning how important hormone balance is when we talk about testosterone therapy in women, and how important it is to integrate this testosterone therapy with an optimized hormonal environment, because I believe this is one of the key factors that will play into ensuring the safety of testosterone therapy and protecting a woman's cardiovascular well-being. So what do the other hormones have to do with the testosterone therapy? And why do we really need an optimized hormonal environment? Well, because nothing in the body is working in isolation. And the testosterone hormone is a part of the much bigger picture when it comes to hormone balance. So it's not alone. It's not working alone. First of all, the testosterone hormone, it's always going to be part of the sex hormone triad: estrogen, progesterone, and testosterone. And personally, I am a very firm believer that estrogen is a woman's yin and testosterone is her yang. You cannot have a balanced body if you don't have a healthy balance between your yin and your yang. I think everybody knows that. Well, Chinese medicine knows that. Chinese medicine has been around for thousands of years before allopathic conventional medicine even got invented. And Chinese medicine believes that a major imbalance between yin and yang energy can cause major illnesses and ailments, and ultimately will impact not just the physical body, but also the emotional body, because an individual with the yin and yang imbalance will not be at peace with oneself and not be comfortable in one's own skin. So since testosterone has been largely ignored when it comes to addressing its value for a woman's body, because the past 100 years have literally just been all about estrogen for women, testosterone has a lot of catching up to do. But simply making it all about testosterone is wrong, because a woman's body needs to be in balance. And for a woman's body to be in balance, her feminine hormones and her masculine hormones have to be balanced. And more so, testosterone therapy has to be balanced by an optimal, not just estrogen and progesterone, but it has to be integrated with an optimal thyroid and adrenal function, as well as ideally insulin and growth hormone balance. Just like an orchestra playing a symphony, all these hormones have to play well with each other and together in unison in order to create the beautiful and awesome melody that they're supposed to create. And this melody is going to be the tune to which the body will beautifully dance. And this melody will be able to allow the body to dance beautifully to the tune of its hormones. Now, I got a little poetic here, but obviously you got the fact that the song of the hormones refers to all the hormones optimized together, working in unity and balance. And then the dance of the body is actually the physical expression of these hormones being balanced into the sensation of well-being and optimal physical function. Now, I have spoken about hormone optimization before. I had dedicated 3 episodes on it. This is not a redo of those episodes. It was just a mention, hey, your hormones have to be in balance for your heart to be healthy. I believe those episodes are 128, 129, and 130, where I talk about the importance of why hormones need to be optimized. Now, the point many physicians and many women who use testosterone therapy ignore is the fact that focusing on testosterone therapy only and ignoring the value of having a balanced therapy of estrogen and testosterone could lead to consequences which we are not able to fully comprehend as physicians and counsel women, because no one is gathering long-term data on testosterone-only therapy for women or testosterone-dominant therapy for women. Obviously, I'm referring to the cases when women use a lot more testosterone than estrogen, and they feel so good, they don't care about estrogen at all, they just need some estrogen. They realize without estrogen, it's even worse, so they have a little bit of estrogen, but they feel more estrogen does not agree with them, but they're severely testosterone dominant. And then there are women who either by choice or by necessity use only testosterone therapy. Maybe breast cancer survivors would be the perfect example of that. Now, women care about feeling good. And guess what? They feel great with testosterone therapy. It is a controlled substance for a reason. In the 1990s, it was used for doping and excessively and unsafely used for bodybuilding with very unpleasant consequences. So guess what? It became a controlled substance. Most doctors want their patients to be happy. And it is very easy to give in to demands for more testosterone when women come back saying, "Hey doc, I feel great. I have no issues. But I think a little bit more testosterone would feel even better." But guess what? Her testosterone levels are already high. Over 300, maybe even higher. So is there a risk for a woman who has a persistently elevated testosterone level to develop a heart problem? Well, there's some limited evidence that perhaps indeed supraphysiologic levels of testosterone therapy in women for long term, how long, we don't really know, could be associated with left ventricular hypertrophy. That means that the left side of your heart is going to enlarge, which unfortunately will impact the valve between the atrial and the left ventricle. And the enlargement of the heart chambers is going to create a condition called valvular insufficiency. Now, why would elevated testosterone hypertrophy your heart? Well, the obvious explanation is maybe because testosterone does stimulate muscle growth and can recruit muscle development, especially when there is demand on that specific muscle due to increased activity. Well, women on testosterone therapy are more motivated to work out and exercise, and data has shown that they're much more physically active, placing more demands on one of their most important muscles, the heart. So, like I said, at this point, this is simply observational, very limited evidence about there could be a possible consequence for long-term supraphysiologic levels of testosterone. How much? We don't know. Is 200 good enough? Is 300 to 400 when actually this can happen? We don't know. And we might not know until a few decades down the road if this is true or not, because we need more data gathering. And apparently people are just gathering data regarding testosterone therapy for low sexual desire. Nobody's really interested in looking at how testosterone is impacting other things. But for the time being, I recommend caution. So next, I'd like to talk about what you should look for when it comes to symptoms that could indicate you are having a problem, possibly a problem linked to your testosterone therapy, impacting your cardiovascular health. Well, obviously, the most critical sign and symptom that you have a cardiovascular issue would be chest pain or chest pressure, especially the kind that would last more than a few minutes, and that might happen with stress or activity. Chest pain is always an alarm signal you want to immediately evaluate, either by going to the emergency room or calling an ambulance, or if it's during the day and you're okay and you don't think this is serious, at least you go to your doctor's office that day, not the next day, not the next week, or you go to an urgent care to have an immediate exam and a simple evaluation with at least an electrocardiogram. Another thing to look for is unusual shortness of breath or trouble catching your breath, especially with low level of activity or maybe zero activity while you're resting. That is concerning. Palpitations are a rather important warning sign of a possible cardiovascular problem, perhaps a problem with your heart and its rhythm. I've had women who are actually very sensitive to the stimulating effects of testosterone and have had significant palpitations with testosterone therapy requiring a dose adjustment. I also had that with estrogen therapy, but more so with testosterone therapy. Obviously, these women are likely in a much better situation to be kept safe from dangerous consequences of testosterone therapy for their heart. But what about the women who do not have warning palpitations, but they still suffer subtle underlying changes of the heart? Anything should be taken seriously. That's why it's important to do tests, which I'm going to tell you about in a minute. Another symptom, fainting or unexplained almost fainting or significant dizziness could be a sign of cardiovascular dysfunction. Now, it doesn't necessarily mean that this cardiovascular dysfunction is related to your testosterone therapy, but if it happens and it never happened before, we should consider it. Now, if it happens 3 months after you started your testosterone therapy, it's probably not that. But if it happens 3 to 5 years into your testosterone therapy, I would look at it seriously. Anyway, any fainting episode in a woman over 50 should trigger a serious workup that should include at least electrolytes, a kidney function, anemia workup, evaluation of sugar metabolism, at least a basic evaluation of the heart with a stress test, an EKG, a calcium score, etc. And I would say at this point, a cardiology visit would be a must. Last, not least, one more symptom I want to tell you about is swelling in the ankles or swelling of your abdomen. Sometimes women feel that as bloating. It is a sign of fluid buildup. And it's also a sign of heart dysfunction or unusual fluid accumulation. And it is well known that testosterone can cause water retention. So clinical signs of swelling need to be closely monitored. And women should be warned of what to look for and when to call the office, ideally immediately when these symptoms are noticed. Now, what concerns me the most in the long term is I have noticed some women have changes in their lipid profile. In spite of being thin, exercising more than regularly or more than the average woman, and in spite of having an extraordinarily healthy diet, and on top of that, managing their stress very well with stress management techniques. So you can't blame their cholesterol lipid change on anything other than probably testosterone therapy. These women have optimal estrogen levels, and even though they frequently, interestingly enough, have some other suboptimal thyroid issues that are being addressed or some mild insulin-resistant issues that are being addressed, they continue to have these cholesterol levels that are fluctuating a lot, 20 points higher, 20 points lower from time to time, and sometimes even more. So is testosterone therapy responsible for these fluctuations, especially when it turns out that cholesterol is increasing and not the good kind? Again, we don't know much right now. This is enough to ask and consider whether this matters in the long run. But what concerns me the most is that when asked, the majority of women who come to me for hormone therapy and they're over 50 say, no, I haven't seen a cardiologist and I've never been referred to one. And obviously, I know this is the last episode on a 3-part series and talking about cardiovascular health and testosterone therapy. Probably a good idea to remind you that after the age of 50, your best doctor friend, well, it is your hormone doctor, but the second one is a good cardiologist. Why? Well, obviously, your heart is the most important thing that keeps your body running and going every day. So you want your heart to be in tip-top best shape it could be. You want your heart to be in it for the long haul, especially if you want to live a long life. More so if you want to live a fully functional and enjoyable life beyond the age of 70. Otherwise, you're going to be one of those people that has a life limited by fatigue, weakness, and a variety of chronic limitations imposed by, guess what? A dysfunctional cardiovascular system and a weak, sick heart. I personally do not understand why so many people ignore the possibility of having a heart medical condition until it's too late and they suffer a heart attack, which leaves them incapacitated and suddenly with the realization they have to change their lives or die from another heart attack, which will be imminent if there is no change. Also, what is mind-boggling is that the great majority of people who die of a heart attack die because they ignored the possibility that they had a cardiovascular problem, a heart problem, until it was too late. And they suffered a sudden death, end-of-life event, the heart attack, because unfortunately, in many cases, that will be how a heart medical condition will manifest. With a heart attack, which is so severe, it ends in sudden death. So ultimately, the question is, what could women look for or pay attention to, and how should their overall well-being and biological markers be monitored while they're using hormone therapy, including testosterone, or mainly consisting of testosterone therapy? Well, I'm going to do a quick summary here because some of these were actually reviewed and discussed. But an annual EKG is mandatory if you're over age 50. If it's normal, once a year. If your EKG is abnormal, it is an automatic cardiology referral in my book. Now, EKGs are easy. Many offices perform it now. Your PCP, your internal medicine doctor. I have my own EKG machine. It helps me with pre-op clearances and annual checkups. We actually, before we got it, we had to refer to a cardiology office to do it. It was so inconvenient and so annoying and added a step our patients completely resented and hated. So I got an EKG machine. Not that expensive, a few $1,000. And the insurance doesn't pay much. I think they paid $30 for an EKG, but it's such useful information. I actually was able to diagnose a gentleman with atrial fibrillation in the office when he presented with, I don't feel so good, and it's the end of his day, and he stopped by on the way home. And sure enough, I said, listened to his heart and said, okay, well, we need to do an EKG right now. And he had an atrial fibrillation. Went straight to the ER. So an annual EKG. Another annual or every 6 months, lipid profile, highly recommended if you are on testosterone therapy. And if it's significantly abnormal or the doctor recommends any medical intervention like a statin, or you're finally decided you need to do some lifestyle changes hoping to avoid the statin, or both, I would recommend the 3 months follow-up test. Otherwise, 6 months to 12 months, depending on your risk, your levels of testosterone, your age, etc. Follow-up fasting insulin, fasting glucose, and hemoglobin A1C. That's at least once a year if it's normal. All women who are in menopause should have that. And likely every 6 months, if they're on testosterone therapy and if their body weight is not optimal, or they have prediabetes or insulin resistance or high cholesterol. At least an annual check on inflammation markers is recommended. My favorite inflammation markers are oxidized cholesterol, LPPLA2, myeloperoxidase, fibrinogen, high-sensitive CRP, maybe interleukin-6 or galectin-3. I talked about these in a previous episode. This is just a little summary to remind you. These are the most common biological markers I implement and frequently use and recommend in my practice. Now, keep in mind, not all these are necessarily covered by insurance, and Medicare loves to not cover a lot of these. They might come out of your pocket, and they will need to be repeated if abnormally elevated also to see if they're back to baseline. And you might have to consider some serious anti-inflammatory strategies to lower these markers as they increase your cardiovascular risk substantially. Now, remember calcium score? I talked about calcium score ad nauseum in the previous episode. It should always be done at age 50. If you're a woman in menopause, even if you're not in menopause at age 50, have one as a baseline. Any significant plaque noted warrants a cardiology referral. So you notice that a lot of these things I said, okay, abnormal EKG, go to the cardiologist. Abnormal calcium score, go to the cardiologist. I love cardiologists. I think we need more cardiologists that specialize in preventive heart health. Unfortunately, cardiology is a specialty where in many practices, the focus is simply on 3 things. Abnormal cholesterol and prescribing a statin for it, almost always focusing on control of blood pressure and prescribing medications for it, or performing a bunch of procedures, which are necessary, not always, but it is true that these procedures can provide data which is reassuring. And any information is good information as long as both the patient and the doctor understand the limitations of the test and its reassuring findings. Again, not all the tests have the same value when it comes to your heart health. So let's talk about quickly some of the most commonly performed tests in the cardiologist's office. So when you get referred, your doctor will probably tell you, hey, I really want you to go because you have an abnormal EKG. You might need a Holter monitor or a stress test. So they will already explain and kind of tell you what I think your cardiologist should do. But well, God forbid you want to tell a cardiologist what to do. They're going to do their own thing, right? So you might expect to have an EKG done, an echocardiogram, which is an ultrasound of your heart, a stress test, which is a treadmill test. You get on the treadmill and the doctor will have to go up on the speed and the incline to the point where your heart rate achieves a certain desired level for your age. And they keep you at that heart rate for, I believe, a minute. And then they do an echo. And they measure something really important called an ejection fraction. And that is the capacity your heart, and especially your left ventricle, has to contract effectively to pump the blood. So it measures your heart's activity and its ability to perform its function. You don't want to be below 50%. That we got a problem. So you want to be ideally above 75%, but very few people are that, maybe athletes or people are in good shape. But anything between 50 and 75% will probably be reassuring and good. You might have a remote Holter monitor test. That's a prolonged EKG where you just have a little electrode slapped on your chest. Well, not slapped, right? Placed on your chest delicately, nicely. And you have to bear with it for probably about 1 week or 2 weeks or 3 weeks, depending on the amount of time your doctor decides it's necessary. So if you have palpitations once a week, it's probably going to be at least a week or two. But if you have some kind of heart events that occur very rarely, they might want to do a monitor for an entire month. Sometimes the cardiologist will do a tilt test, which is how they usually detect changes in your blood pressure due to gravity. And that's how POTS syndrome is diagnosed. And maybe once in a blue moon, a bubble study, which is a test where they inject small microbubbles in your heart and track the flow of them with an ultrasound to see if you have a hole in your heart that could put you at risk for a TIA or a transient ischemic attack. So lots of tests in the cardiology office, right? They're busy. But keep in mind that even if reassuring, none of these tests indicate or measure plaque in your heart. A CT of your heart, like a calcium score, will measure the hard calcified plaque. And a CCTA, or a coronary computerized tomography angiogram, CT angiogram using contrast dye of your heart will measure the soft plaque, which is the dangerous plaque. All the other tests are reassuring, but superficially. And they're not really looking for whether or not you are at risk for a heart attack, okay? They're looking at other things, but they're important because your heart health is not just about the heart attack. There are other things that could be important here. I would like to, as I'm approaching the end of this episode, end with a quote from Dr. Bob Rayco's words. I came across these on a repost from Dr. Mark Hyman, which I follow on LinkedIn, and they stayed with me. And I'm going to read them to you verbatim. Your heart attack at age 50 started at age 20. The Alzheimer's at age 70 started at age 40. The loss of independence at 80 started at 30. The aging you want tomorrow starts with the choices you make today. Please ponder these words because it makes me think about the future of medicine and how the practice of medicine needs a major shift from dealing with the inevitable to promoting health strategies that avoid the inevitable. And nothing is more true when it comes to your heart health, because the inevitable is the heart attack nobody wants. The inevitable, it's the sudden death from a major, massive heart attack that could have been prevented. So we need to stop looking at treating the inevitable, and we need to be more proactive. The truth is we take our heart for granted. It beats an average of 70 to 85 beats per minute. That means an average of 42 million times in 1 year. That means there are an approximate 2.8 billion times the heart beats over the time span of an average life. What muscle in your body do you know of that actually works as hard as your heart does? What other part of your body will stop working and then you immediately die in less than a few minutes? Well, the answer is simple. You already guessed it. It's your heart. This is your engine. Without a good engine, you go nowhere. I would like to give you a few numbers because they blew my mind. Did you know that the heart pumps the equivalent of 2,000 gallons or 7,000 liters of blood every day throughout your body? Think about the enormous amount of energy required for the heart to function normally and efficiently in order to contract so many times and deliver so much blood day after day for almost 80 years, likely 100 or more for some of us. Your heart is constantly working. It is one of the most energy-demanding organs in your body. It's requiring specialized mitochondria to produce the necessary ATP, which is the fuel for our mitochondria and the energetic currency for our human bodies. And interestingly enough, the heart relies on fat and protein, not carbs, as a prime energy source. Some food for thought there. And I don't know if you knew this, but I thought it was interesting. The human heart has the power to create enough energy in a lifetime to drive a truck all the way from Earth to the moon and back. Again, mind-blowing, right? So in conclusion, do not take your heart for granted. Know your heart's health status. And daily, whether you do it at the beginning of the day or at the end of the day, look at the environment you are forcing your heart to work in. Look at the stress, the sleep, the diet, the exercise, the inflammation, the toxins, and the hormonal support, to name a few critical factors. If you are over 50 and are using hormone therapy for menopause or for aging, do not take your heart health lightly. Check your heart, check all the markers I recommended. Knowledge is power, the power to act, to protect and optimize your heart, to beat for as long as you want it to. Thank you for listening. Thank you for the time and energy you spent listening to my podcast. If this episode or another have caught your attention and delivered valuable information you have not heard anywhere else, and if you feel I have succeeded in my mission to provide the how to stay healthy and age beautifully, please leave me a review. And any suggestion to improve the podcast will help make it better for you and for others. You can send my staff a message directly by sending an email to receptionist@herahealthcare.info.